Welcome to the Allied Health Professionals podcast series
with your hosts Jennifer Trafford
and Alison Kerr. Hello everyone, and today we have
Kelly McLean, and I'm team leader for the front of house therapy team. I've worked in the trust for 9 years, but I actually started my career here a long time ago, and then I did all my band 5, band 6 rotations, left to go travelling, then I came back to work front of house, and I've been there 9 years and enjoying the job.
Excellent.
Welcome to the podcast. And we're also with...
And I'm Gina Thomas. I'm also therapy team lead for front of house therapies. I've worked in the trust for about 12 years, did my rotations as a band 5 and then moved on to a band 6 role in the community. And then I came back to the acute trust about 4 or 5 years ago and worked in front of house since then.
So we've got a lot of experience in the room.
Absolutely. So front of house therapies, tell us a bit about what is that in a nutshell, kind of what does front of house therapies do?
Yeah, so we're an integrated team. So there is physiotherapists, occupational therapists, and advanced therapy practitioners, and we will all work together in the same team. We cover A&E, same day assessment unit, Ward 1, Ward 37, which is the acute assessment units, and the short stay wards. We're a 7-day service. We work 12-hour shifts, so that's quite different. So we're very flexible. We bend and flex to the demand on the hospital. Obviously, been very busy with winter at the moment, so we work together to try and give the best care and quality of care to our patients.
12-hour shift?
Yeah. 8 till 8 every day.
Every day. So you cover Christmas Day?
Yeah, I was in Christmas Day.
In Christmas Day? Wow, well, thank you for that dedication.
So what made you both lead you into the front of house therapy team then? What brought you into that team?
So I was part of the community rotation as a band 6. Part of our rotation was to rotate into front of house therapies. I got experience here and enjoyed working within the service but also within the team as well. And then there was a secondment opportunity to come for maternity cover. So I did that for a 12-month period and then got a static post after that. And then I'm currently in a secondment post as band 7 for maternity cover at the moment.
So when you're talking about a rotation, what's that include then? And do you still do that?
So as the post I'm in at the moment, it's a static post, but the rotational post is still out there. And it's a 12-month rotation where you would move to different clinical areas within the same sort of role. So it was based in community hospitals, in patients' homes, pulmonary rehab, and front of house therapies was part of that as well.
Right. So does that allow people then to have an experience of different kind of areas, and then do you then choose from there where you're going to go, or can you continue on a rotational?
So you could continue on the rotational post for as long as you wanted, but it gives you the opportunity to have the experience in specialist clinical areas and then choose where you would like to specialise longer term.
That must be really nerve-wracking when you're going into a new team every now and again. You're literally starting with a new team. So what do you do for your rotational band 5s that come in, that are coming into, I'm assuming, a really well-established team, to make them feel psychologically safe enough to be part of that team? What type of things do you do for them guys?
So we've developed a programme for the new staff that rotate into our team. They have 2 weeks supernumerary where they have a staff member that they buddy up with, and then we have an 8-week follow-on period of that again for additional support. We've developed a training programme where we've got lots of different presentations that we can run through with them for their own learning and development. And we also have an in-service training that we complete every month for the development of the band 5s, but also the wider team as well.
It sounds like an amazing opportunity, doesn't it?
Yeah, definitely. I think it's definitely worth a big plug on this podcast because it's really interesting. The skills you must gain from doing that as well. It'll benefit no matter where you work and whether you work back into that area. So it's brilliant.
We're also part of the transfer of care hub as well. So we're all based in the same building. So part of that induction period, the new band 5s would shadow the social workers, the transfer of care hub, the discharge facilitators to get a holistic view of what we do and what's involved in the discharge process, as well as shadowing the ward staff because we work really closely with them as well. So learn how to take blood pressure and SATs and things like that with the healthcare assistants or whatever the Band 5 needs to develop and thrive in the role.
Very adaptable skills.
Absolutely. So for people kind of thinking about their rotational, give them an idea of what a day in the life of somebody at front of house would look like.
So, as Gina said, we've got that robust induction period, so they'll be supported. They'll have a named senior who will be their mentor for the time that they spend with us. We not only have physios in the team as Band 5 now, but recently we've got OT as well, so it's across both professions, and that's quite new. So on a morning we meet at 8 o'clock and we have a little huddle. We all have our allocated areas that we're covering, but that member of staff will be with another person initially, and then once their confidence grows, they'll gradually be exposed to working more autonomously on the ward. And then we bend and flex to the demand. So even though different staff have their own area to cover, we meet again in the afternoon, see if anybody needs support, where the pressure is, where the priorities are, and we bend and flex and we help each other out and we work together as a team, don't we?
We do, yeah.
Yeah.
So what's the benefit of having a therapies team when it comes to front of house? Like what is it that allied health professionals bring to a front of house environment, if you like?
I think our role's unique, isn't it? Because we're not just providing physiotherapy, OT, we all work on a competency-based programme as well, so we're all skilled to do a bit of each other's role. So the new staff will get a competency pack that they'll work through as well while they're there. And the benefit is that we're not just looking at therapy, we're looking holistically. So we do a comprehensive geriatric assessment and we'll look at social care. We'll set up packages of care, liaise with the TOC team and the community services to ensure that the patient gets home as safely and as effectively as possible on the correct discharge pathway. But also we order equipment, and we refer to different services like falls services. Whatever that patient needs, we use our community map and we'll refer to even voluntary services we tap into as well.
Yeah, it's one of the advantages of allied health professionals, isn't it? Is that just the reach, the knowledge and the reach of the people you need to interact with, because that's exactly what you need to do in your role. So have you got, obviously that's the day-to-day, is there any projects or anything that you're working on that's been able to push the service forward?
Yeah, so recently we're very frailty focused. So a lot of our patients are frail and elderly and have complex needs. So in the emergency department, we have a frailty team as well, and we work closely with those. That team will see the frail patients. If they're not frail, the front of house team see their patients. But if there's anybody that's been in the department within 24 hours that hasn't been seen, we do a trawl of the Symphony database and pick out patients. And initially we were just giving them a telephone call to try and prevent them reattending. But this pilot, the Frailty Proactive Care pilot, picking out patients, and we're actually going out into the community and seeing these patients at home, doing the comprehensive geriatric assessment in their own environment where they're a bit more comfortable, a bit more relaxed. It's more personable as well, so we can get the best out of the patient, and then we'll do that assessment, make that individually tailored management plan, and then we meet in a MDT, virtual MDT online, and we'll refer into the different services and discuss that case in the MDT, and it's working really well.
So is one of the benefits from that stopping the pressure on the hospital, on the acute hospital, and that a lot of it's care given at home?
Yeah, so having that assessment at home, we're getting a more accurate picture of how they're able to manage within their own environment. And the idea is that we're trying to help reduce that readmission or reattendance to hospital.
So relevant at the moment, isn't it? We're listening to the news at the moment, aren't we? And it's all about winter pressures. It's all about our kind of A&Es being filled and back up. And there's a lot of talk around kind of like the flu and things like that. So anything that we can do to relieve that pressure is huge, isn't it? So that's such a good project.
So in terms of other leadership development for members of our team, there's some projects that we are implementing or currently involved with. We're looking at preventing deconditioning of the patients in hospital for a longer period of time on our wards and that are not medically fit. So we look at creating a list of those patients that would benefit from some form of exercises, whether that's chair, bed or standing exercises, and looking to try and reduce the risk of them deconditioning while they're in hospital. So we're facilitating that through the team and pushing that on the wards. We're also in working closely with the falls team to look at developing and implementing the steady on your feet on the wards, which is looking at falls prevention for our patients to try and hopefully reduce further admissions.
So it sounds to me like you guys work with a lot of different teams outside of your kind of main team. Sounds like you do a lot with different teams outside of that. How are you doing keeping them together and making people feel like that must be difficult?
Yeah, I think we collaborate a lot with lots of different teams. On the ward that we work on, we work together with the nursing staff. We have daily ward rounds with the doctors and the staff, and that happens twice a day to make sure that that forward thinking and the planning's happening all of the time. Like I said, we work with the frailty team. We hand over to the wards if the patient's staying, and we've started the assessment. We hand that over so that they can follow that pathway and carry on the good work that we've started. We dip into a lot of different teams.
A lot of MDT work and going on. It's so, and the thing is that's the way we need to think now, isn't it? We need to think more systems kind of approach, don't we? And how we link with each other and what we do affects the next stage or the last stage in the process. It sounds like you have got that really well established.
Thank you.
Yeah, amazing work. I know we were talking before the podcast and you were telling us that one of the things that you are doing, again, kind of working on this team building and making sure that you're bringing your teams together. And you were telling us that you were one of the first therapy teams to start the Athena journey.
Yeah, that's right. So we're one of the first to pioneer the Athena journey, and that's with the support of the OD and training team. Heidi Williams, who is an AHP herself, she's a physiotherapist. She's been facilitating and helping us along that journey. And how that started was because of the team have gone through lots of change, when COVID and things like that, morale at one stage was quite low. So we asked for some feedback from the staff, and we tried various different things ourselves to try and work through some of the issues that were raised. And then I went to speak to Heidi about it, and she looked at the different feedback and then decided, this Athena journey would be really beneficial to the team to help redefine roles, establish team identity, role clarity. We've redefined our objectives, and the team have been heavily involved in that. And we've set our own team operating principles, a code, if you like, or a trust mission that we work, and the team have drawn that up themselves, and we're working towards that to try and strive to be the best team that we can be. I know we've got an amazing team already, but there's a lot of skill there that we just need to keep developing, and we're really keen, the both of us, to develop the junior staff in the team.
I'm glad you've said that, actually. I'm glad you said we've got an amazing team already, because I think the thing is when we talk about this type of work, about the importance of kind of them non-technical skills and establishing them, people think that what we do is we only work on them if we've got a team that's failing, but actually use a real evidence of even them high performing teams, and use it obviously showing that you're a high performing team. Stay high performing because you work on it, because you actively work on it. So it's really important, isn't it, that you continue to do that element of things.
Absolutely.
I think as well with the Athena journey, you can always revisit things again, go back, can't you, and understand that you are on a journey, and knowing that the patients are always going to be changing, the staff's going to be changing, and just encourage a lot of teams to either look into the Athena journey. Your team's already awesome. You just know that you're still on a journey, and you can make it even more awesome as well, not just for yourselves but for all the staff. Such a great message to everybody in the organisation, really.
Yeah, it sets the tone for your culture, doesn't it, of what you want to establish. So why should they want to come to front of house?
So I think we work as an integrated team, so it's around the staff being able to develop their skills and work closely with other members of the MDT, and it's quite a fast-paced team. The work's quite fast-paced, and it's about adapting to that, but we've got a good team that provide really good support to each other, and it's about us being able to support the staff to develop further in their roles.
So what kind of courses are open to practitioners like yourselves?
Yeah, so I mean, Gina and I and the whole leadership team in the department is very keen for personal development and team development, like we've been talking about. So we actively encourage staff members to take part in in-house courses and learning on the job. I think, you know, you can get a lot from just learning on the job. And every member of staff has an SDR, so an appraisal. We follow the appraisal and work out an individual plan to their needs, because everyone in the team's got different skills. So it's trying to maximise the potential with the staff. So examples of development and success that we've had in the team, we've had 2 advanced therapy practitioners, one that was static in our team, another one that was a student that came and has just finished the band 5 OT rotation. We've supported both of them, and that's Craig Sandwith and Adam Goldsack, and they were successful and are now qualified OTs in the trust, and they were both actually nominated for a star award at the AHP day. So they've done amazing. So we have Holly Scrafton in our team, who's the CSP rep, and she's been very busy lately. So we give her protected time to support that role and her development, and she's excellent at what she does. And she's also been she's now regional rep, not just rep for the trust. So she's regional.
Amazing. Can I ask, just for people who don't know the acronyms, CSP?
Chartered Society of Physiotherapy. Yeah, we also support the organisation. So with Winter Pressures, our team has supported a member of staff to second onto the Winter Pressures, and off the back of that, we were nominated for a star award for going the extra mile and being flexible and having like a can-do attitude. So the team have done amazing, and we can't thank them enough. We're very proud of them.
It's lovely when staff get nominated, and I would encourage everybody to nominate constantly their teams, because we do not shout about it enough, do we? We do not.
I agree
for all the
totally.
great work, so well done.
Thank you.
I think somebody's not blowing her own trumpet enough here either when it comes to. Do you want to tell them what you've been doing?
Yeah, so I'm obviously a band 7 physio, but I'm a trainee advanced clinical practitioner. So I've just finished my endpoint assessment.
Excellent.
For the Masters Advanced Clinical Practitioner at Teesside Uni, which has been amazing. I've learnt a lot, but when you're working full time, you've got young children, and fitting the clinical hours and the supervision in and things, it's been a challenge, but I've got there in the end.
Well done.
It's so good to hear though the progression routes that people have. So what is that going to mean to you now going forward? What doors will that open for you?
Hopefully it'll open a lot of doors, because previously I've done master's level work, like a leadership course and the student mentorship one, but that was quite a long time ago, and if you don't use those credits in a certain amount of time, they don't count towards the master's. So I was doing all these courses but never going to have the master's accreditation at the end. So I went for the advanced clinical practice course, and I'm hoping that will open more doors in terms of crossing professional boundaries, because as part of that I've done the clinical skills module. I'm now a non-medical prescriber, so that opens up a lot of doors, not only for myself but for the trust, because you've got more opportunities to cover for different roles and different opportunities and winter pressures or whatever that might be. So it gives the trust more skill to dig into.
Yeah, I think our organisation is, when we've looked regionally, is really quite advanced with our AHP, ACPs, and I think getting that community of practice and sharing the experience that you have inspires others to either do the course or to learn from each other within that. And I do think the ACP route and the roles really just opens it up for what the organisation can achieve for patient care. It's fantastic, so well done you.
Thank you. And Phil Howard, he's my mentor, so he's the clinical lead in physio. He's been really supportive and helped guide me through it. And I think it's made me realise how resilient I am when trying to manage a team, fit in all the other pressures, but also manage to get through the academic work as well. So yeah.
Well done. Hat is
Thank
off to you. And Gina, I know you did a seconded post, didn't you, to help with your kind of advancement.
Yeah.
So what was that, and how did that open doors for you?
So initially I was on this band 6 secondment to allow me more experience within the team. I'd done the 12-month rotation, but then it was another 12 months to receive more sort of experience within the team. And then an opportunity came for a static post within the team, so I've been able to develop further. Got experience over the last 4 or 5 years, and then an opportunity came up for the band 7 within the team, so I've just stepped into that post, and it's been a challenge, but I feel like it's going well.
Yeah, can I just say, I know you can't see this, but actually, when she starts talking about it, her face glows. You're obviously very proud of kind of the achievements, and rightfully so. What advice would you give for people who are wanting to stretch out of their comfort zone and are a bit nervous about it?
I'd say go for it. So, there's opportunities there, and you've just got to take them and, develop your own skills within that.
Have you had to lean on either other support from other colleagues, or look for areas where you think, oh, I need to know about that, I'm going to go and do a course on that, or I need to seek some clinical supervision from that person, or coaching or anything like that?
Yes, I've completed the leadership course, and I've done various other courses through Strive, and our team, when I was a band 6, there was a lot of opportunity to be able to do those kind of training and courses. And then in the post at the moment, Kelly's been a really good support. It's been challenging because we're not on shift together very often, so it's a lot of communication over email, but no, she's been really good support through it.
Oh, thank you.
I love doing these podcasting with the teams, because when you come in, it's just buzzing to see you when you're working together, and then you get the chance to talk, because you don't often in your day-to-day work get to talk about yourself and your achievements, and it's so good to hear, and we're privileged to have you in the room, and we're very proud of you, so thank you very much for coming.
Yeah, and thank you for all the work that you're doing, because front of house is so important. And like you say, the stress that you're taking off other areas in the hospital, I don't think a lot of people understand the things that you do, and that the effect, if you weren't there, the effect it would have on the rest of the hospital. So from our point of view, absolutely, thank you for everything you do, and it's been fabulous having you here.
Thank you.
Thank you for coming, and look after yourselves
And each other.